to just follow up with some more questions about the mental health nurse incentive program, first of all, please. So I think it might come back to the question that Senator McLucas was asking, but the Royal Australian and New Zealand College of Psychiatrists have questioned why the budget shows that funding for the program is only continued for 12 months. Does the program have ongoing funding over the forward estimates?
The answer to that, Senator, is as for those previous ones, that the funding has been put forward for the next 12 months and will be considered in light of the findings of the Mental Health Commission review.
Okay, so I got the impression that Senator McLucas, I was listening carefully to that, was asking about funding for the 2015-16 year.
And we were giving the 13-14 and 14-15.
Yes, that's right. So you can't. So that's actually subject to the review.
That's right. That's right. So the funding's
that.
guaranteed for 12 months, but in light of the Commission report.
Can I ask about the GP co-payment? Will that impact patients seeing a nurse through the Minute program?
I can't really comment on the patient co-payment, Senator. That's again, that's another outcome area, and I'd need to. Take that on notice.
Could you take that on notice for me, please? Did the government consult at all with the mental health sector or consumers about the possibility that a co-payment would discourage people with a mental illness from seeking help?
Again, Senator, I can't comment on that.
Perhaps I can ask the Minister's representative here.
That's a budget matter, Senator. But
well, no, it's a question.
Hang on, let me finish. Sorry, that's a budget matter, but insofar as I can, I'll take it on notice and try and provide you.
Right, because, I mean, it is a very legitimate question. Again, we can say, well, governments can choose to charge anything they like, but we're in the mental health estimates. There's accepted wisdom that early intervention or prevention is optimal when it comes to health, but particularly mental health. It's not really controversial. And so, obviously, people are interested in knowing if there is a possibility, a risk, that a co-payment will actually prevent people from seeking that help early. Was there any consultation about that measure before it was decided upon in terms of this area of health? So that's what I'm asking. And also, will the co-payment be charged for mental health items such as the GP mental health care plan and reviews of the care plan?
Again, Senator, I'd need to take that on notice and raise it with colleagues in the MBE.
So you don't know the item numbers that would be applicable?
I would rather take that on notice, Senator, because it's not an area that we look after. The co-payments area has been looked at within another area.
Is the Minister's representative able to shed any light on that?
Not the specific details, Senator. I wouldn't like to make an assumption, so we'll get you the factual detail around that.
So can I ask then what the total funding for the mental health nurse incentive program was in 2012-13 in terms of what was actually spent?
So the total allocation in 12-13 was 39.689.
39.689, is that right?
Yes.
Sorry, it's terrible acoustics in this room, so that's why I'm clarifying. Thank you for that. So we've heard about the budget allocations for 2013-14, but what's the expected expenditure for the program?
Again, it would be a very similar amount, Senator, because what's happened is that there's funding been available to maintain services at current levels. So the funding would be expected to be very similar.
So similar to the previous figure you gave then, so the 39.689.
Yes, and yeah.
Okay. I will ask, and I'll ask for this on notice given the time constraints, how many sessions were claimed in each financial year from 2007-8 to 2013-14 inclusive? So how many actual sessions were claimed?
Yes, we wouldn't have that for 7-8 on Okay.
Yep, thank you. All right. And how many sessions were allocated, so actual sessions, in 2012-13 and 2013-14? And if you have those figures now, that would be useful. If you have them.
So in 2013-14,
yep.
A total of 150,079 sessions.
Thank you. And
currently allocated
yep.
to 83 organisations in 2013-14.
to 83 eligible
300
organisations?
383 organisations.
Okay, so they're called eligible organisations, I think,
Yes,
is that right?
yes, yes.
Okay, and what about the preceding year?
In terms of 12-13, I would need, 12-13, approximately 160,000 sessions were allocated in 12-13.
So why is that only approximate there?
I'd need to double check, but it's 160,000 is the figure that
Thank
I
you.
have in terms of allocation. But is that provided?
And do you have the number of eligible organisations that the sessions were allocated to?
The total 65, 135, 216. Not a total number. No, I'd need to take that one on notice.
Okay, so if you could double check that figure of 160,000,
Yep,
it
I
seems
will do.
absolutely
That's the
precise.
allocation.
Yep.
Yep.
And the total number of eligible organisations, and how many will be allocated for 2014-15?
We are looking at up to 165,000.
Thank you. How many organisations are currently registered as eligible organisations for the MINIP?
That would be around about the number that I've just given to you, which was 383. But again, I would need to... So that was allocated to 383. And there are none on the waiting list. So I'll take that on notice, but I would say 383.
To round that figure,
Yeah.
thank you for that. Again, on notice, please, how many organisations were registered as eligible organisations at the outset of each financial year from 2007-8 until the 1st of July 2013?
Yep.
So, how many nurses have delivered services under the MINIP between the 1st of July 2013 to the current date?
Let me just double check. I did have something on nurses. No, I'll need to take that one on notice as well.
Right,
Senator.
okay. And similarly on notice, how many did so in each previous financial year from 2007-8 onwards?
Yep.
Thank you. How many individual patients received services under the program from the 1st of July 2013 to the current date?
Again, we'll take that on notice.
You don't have
and
any
just-
figure there that could help me at all,
Up to
just
you
so I
to
have a
stand.
sense without having to wait for the answer? You can always check it.
No, I need to take that on
All
notice.
right,
and
thank you
just
for that.
double check.
And similarly, how many in previous years from 2007-8 onwards?
Yep.
I'd like to know what the average number of times a patient is seen in terms of sessions attended or claimed under the program.
Yeah.
I've looked extensively at the program and it comes highly recommended from many people, so I'm interested in knowing exactly
Okay, yes, absolutely.
who is being attended to